Disease outbreaks and health emergencies can start anywhere, at any time, and can quickly spread and affect millions. Responding immediately is a matter of life or death. One of the hard lessons the World Health Organization learnt from the West African Ebola outbreak in 2014 is that some diseases move much faster than the funding needed to fight them. So the World Health Organization set up a mechanism to enable quick action. The Contingency Fund for Emergencies, CFE, which can dispense money the moment the need for an emergency response is identified. In 2017, the CFE provided nearly $20 million for operations in 23 countries, with most allocations released within 24 hours. With support from the World Health Organization, Uganda stopped an outbreak of the deadly Marburg virus disease in its tracks. The World Health Organization released $623,000 to contain the outbreak in a remote area on the Kenyan border. And the spread of this highly contagious disease was prevented. In May, the Democratic Republic of the Congo experienced a cluster of unexplained deaths in a remote part of the country. The World Health Organization deployed a team within 24 hours thanks to CFE funding. By July, the Ebola outbreak was over, resulting in 4 deaths. This rapid release of $2 million quite possibly saved thousands of lives and billions of dollars. In contrast, the Ebola outbreak in West Africa in 2014 resulted in more than 11,000 deaths and cost more than $3.6 billion to contain. In Iraq, a CFE loan of $1.5 million kept the Hammam Alil Field Hospital running until additional financing was secured. The hospital provided emergency care to civilians fleeing fighting in Mosul. In 2017, Madagascar was hit by its worst outbreak of pneumonic plague on record, killing more than 200 people. The World Health Organization released $1.5 million to boost the response, which included sending 135 experts and more than 1 million doses of antibiotics. Within a few months, the outbreak was contained. No cases spread beyond the island. Over 600,000 Rohingya fled to Bangladesh in a few months in 2017, arriving in overcrowded camps prone to disease outbreaks. With $5 million from the CFE, the World Health Organization has provided medicines, improved water safety and disease surveillance, and helped vaccinate hundreds of thousands of refugees against measles, polio, diphtheria, and cholera. The CFE's unique ability to release money quickly complements other financing mechanisms, which may have different funding criteria and disbursement cycles. The Contingency Fund for Emergencies helps us act quickly to save lives, stopping outbreaks and emergencies from spiraling out of control. And it is a good investment because prevention costs a fraction of a late response. The Contingency Fund for Emergencies, enabling quick action to save lives.